Hope Channel, changing lives.
Good evening, and you are welcome to the consulting room. I am Dr. Mami Fakosa, your host here in the consulting room, as you'd always have it. And today I'm very glad that I have two very beautiful doctors joining me, Dr. Salasi Dadi and Dr. Abigail Techia Nyaku. Today we are going to have a discussion concerning COVID-19. We were all here in 2019 when we heard a very strange news that there was a certain virus that was coming from China, and very soon it spread all over the world, and it even made some of us stay indoors for so long. Fortunately, in our country we didn't stay indoors for a very long time, but then we still feel the effect of it. That is even the reason why in most places now, or it's recommended in most places, that we wear our masks. So today we are going to have a very wonderful conversation concerning COVID-19, and we'll answer all your questions concerning COVID-19 too. So you're welcome, Dr. Nyako and Dr. Dadi. So Dr. Dadi, you know, when I posted the publicity material, someone asked me if it was a mistake. Is your name actually Daddy?
Yes, my name is actually Daddy.
So your name is actually Daddy.
Yeah, it's actually my surname.
Yes. So please, the person in my contact who asked me if that was her name, you've heard it from the doctor herself. Her name is Dr. Dadi and Dr. Nyaku. You are all welcome to the consulting room. We are going to go straight into the discussion from here. So what really is COVID-19? If you could tell us where it actually started from, so that we have a better understanding of it, because some people think a whole lot of things about it. Can you tell us a bit about COVID-19 and where it started from?
Thank you for your question. So COVID-19 is just coronavirus disease 19. We first heard of it in 2019. So it's actually in December 2019, 31st December, that China alerted WHO about 2019. It was first seen in the Wuhan, Wuhan in China. And by 30th January 2020, it became a public health emergency. And by saying that, I mean, we saw that the rate at which it was infecting other people, it was very infectious, was high. And also people that were getting the COVID-19 disease were dying at a faster rate. And by 11th March 2020, it became a global pandemic. Pandemic means it affected a lot of countries. Yeah, so that's a little bit about COVID-19. It belongs to a group of viruses called the SARS-CoV-2. That's serious, severe acute respiratory syndrome coronavirus 2. That's the name of the group that it belongs to. So
when it came in 2019 and the early parts of 2020, there were some pictures that COVID-19 is new, but then on some of these detergent bottles there was COVID. There was COVID in the antiviral properties of some of these things. So was it really new? Was COVID really new?
So the coronaviruses are not new.
Okay.
As a whole. So they cause different, over the years they've caused different infections and different flus over the years. But then with every one that comes, they have a different variant. So the variants that caused the current infection we have is different from the variants that caused, I don't know if you remember, in 2003, there was also a SARS outbreak in China.
Yes.
So they all belong to the same group.
And we're all very scared.
We're all very scared.
They said when you get it, you are just
yes, exactly. So they all belong to the same class of viruses. So the virus that caused the SARS outbreak then is the same virus that is causing the coronavirus now. It's just they've undergone certain mutations, so certain changes that have made the infection they caused during 20
So they are more like cousins?
Yes, they are like cousins. Yeah, they are related to each other, but they are not the same.
Okay.
Exactly.
So what we have now causing the COVID-19 is the novel coronavirus, so a new variant. Yes, please. Yes.
Then that's there are some people that don't show anything at all when they get infected, and there are some people too that show some very serious signs. So if you can educate us a bit on some of the signs and the symptoms that come along with COVID, the infection that is present.
Okay, so the various symptoms associated, or the symptoms that we see associated with COVID-19, let me say they are non-specific. It means,
what do you mean?
Non-specific means they can also be present in other disease conditions. So usually the common ones, we have fever. Almost all the symptoms are usually
fever,
high temperature.
That's a fever. Please, what is fever? This I just want you to explain, because I've had someone say, "Oh, me there me was fever," but the person doesn't actually.
So
have.
To a layman, usually when somebody is warm to touch, and when you come to the hospital, and only fever. Is kind of say fever. So
viewers, please, fever and yet the mobile hospital. Fever is when your body temperature is high. So when someone touches you, you are warmer than
usually above 38 degrees Celsius. Yes.
Okay. So as you were saying.
Yeah. So you have the fever where your body temperature is warm. So usually our mothers will put the back of the dorsum of their palm on your forehead to tell that you are feverish or you have fever. Then we also have catarrh, where your nose will be blocked. Then rhinorrhea, so you have like fluid or water dripping from running nose. Thank you very much. Then we also have difficulty to breathe, so you are breathing so fast and it's like your airways are blocked, so you are struggling to take in air. So you can also have that as a symptom. We also have myalgia, where you feel pains in your muscles, like your body, and also what we call the easy fatigability. So easy fatigability is maybe at first you could climb 10 stairs without getting tired, but now because of the disease you climb 2 and you are tired. So that's the easy fatigability. We also have some GIT, gastrointestinal tract symptoms, such as abdominal pain. So some people also present with that, and vomiting. So you see, when I started, I said the symptoms are non-specific.
You can get these things that you are talking about in
a lot of disease conditions. So those are the symptoms that we have seen to be associated with the COVID-19 disease. Yeah, COVID-19. So these are the symptoms I can mention. But then some, and also I forgot to mention, some also have loss of taste, loss of smell. All of them are symptoms that are associated with the COVID-19. So the degree of your infection, we have really mild form of the disease, moderate and severe, will determine the symptom you are going to show. So for some, you said some may even have the infection and they may not show any symptom at all. Some too will have maybe sore throat. I forgot to mention for sore throat, and even cough. So some may have some mild form of sore throat, cough, the running nose and all of that. Some too have severe forms where they are struggling to breathe. They have to be sent to the hospital and they have to intubate them, put a tube into their throat to enable them to breathe and all of that. So the type of the disease, whether you are getting the very mild form, the moderate or the very severe form, will determine the symptoms you present with. So that's what I can say about it. Okay. The symptoms.
So now you've told us about the things that we might come with. What do you do? Is there a treatment for COVID? What do you do when? Because I've heard so many neem tree, kosher. We should
inhale warm water,
warm steam,
with ginger.
Are those the treatments?
So because, as she said, the symptoms are non-specific. So usually there's for viral infections in general, there's no cure.
Okay.
So viral infections are usually fought by the body's immune system.
Okay.
So it's the body that would attack the virus and then eventually let the virus get out of the system. But because of the various symptoms you feel, I mean, you'll be uncomfortable. So there are various things you do that will make you feel a little more comfortable. Like, for example, if your nose is blocked and you inhale steam, it sort of creates some sort of temporary relief. So all these things we do are just ways to aid the immune system to fight the virus. So there's not actually like a cure, like the way we have a cure for malaria. That if I get malaria, I'll take this medicine.
If I come and I'm unable to breathe, then you give me
I'll give you oxygen.
Okay.
I'll give you oxygen. I'll give you something that would allow your lungs to work better. Then, for example, you come with a headache, I'll give you a painkiller. You come with a sore throat, I'll tell you, oh, you can take vitamin C, you can take some lozenges and things like that. So usually the treatment is not very specific. We try to work with the various symptoms we have to make you feel as comfortable as possible and to give the body a fighting chance when it comes to the virus. Yes.
So since we don't really have a specific treatment now, what can I do to avoid getting this infection?
I'm sure that, I mean, COVID has been with us for a while now.
Yes.
So there are certain measures we put in place.
And how effective are these measures?
So they are effective to a very large extent because of the way. So when COVID came, I mean, they studied it and then they found out that, okay, so COVID is transmitted by droplets. So for example, if I talk, I let out droplets, and then when they get into your respiratory tract, you get infected. If I sneeze, you get it. If I cough, you get it. If I sing, you get it. So
anything that causes something to come from your mouth or your nose,
your nose, it's more likely to get you infected. So the various measures we have are just ways of preventing those droplets from getting to you, or prevent them from being on you for long enough to infect you if they actually do get to you. So for example, you are supposed to wash your hands with running water, or if you are unable to get running water and soap, then you sanitize your hands as often as possible whenever you touch a surface or anything. Then we all heard you are supposed to keep a meter away from people. So the meter away was calculated based on how far the droplets can travel. So if you are a meter away from someone, then it's less likely that the droplets will get to you. Then another thing too I told was that when you are coughing, cough into your elbow. So when you cough in your elbow, you trap the droplets in your elbow. And because it's in your elbow, it's less likely for you to rub it onto surfaces for other people to touch it. When you are sneezing,
then that makes sense, because people don't actually understand why they have to do those certain things.
Then I think when you sneeze into a tissue, dispose of it immediately. Because if you leave the tissue there, I mean, the droplets are like aerosols. So once air passes, I mean, they would spread. So you use the tissue, discard it, you wash your hands. So you've gotten rid of everything. So those are just methods that were brought up. And then another thing too is you also have to make sure that your immune system is kept at its best possible shape, so that should you get the virus, your body has the ability to fight the virus. So all these things that we were told to do, and I mean we should still be doing, wear a nose mask, which has now become like the fashion in these times. The nose mask is to trap the droplets. So now when you talk, the droplets don't come out as much as if I wasn't wearing a nose mask. So all these things are just measures that have been put in place to reduce the spread of the virus.
So if all these measures have been put in place, why then do I have to go for the vaccine? And you people are saying now there's a vaccine. You said there's no cure. Then later you told us that when you fall sick, we can you can help us with some of the symptoms. We've accepted. We should wash our hands. Our soap is finishing, but we'll use it. We should buy 60 to 70% of alcohol sanitizers. We are using all those ones. Keep a meter away. So in some countries, there was isolation or quarantine for weeks. We just had it for just about 3 weeks, and we were almost dying. We are doing all these things. So why then do you doctors and health professionals advise us to go for the vaccination? And what is the vaccination about?
Okay. Before I talk about the vaccination, I wanted to add that there is just one drug at the moment that is FDA approved for the treatment of COVID-19.
Is it Ghana FDA?
No, please, in the US. You know, we are really at the latter part of the food chain, so it's not here yet. Okay. Yeah, so that's actually, I think remdesivir, that's actually the only recommended FDA drug for the treatment of COVID-19. So back to the issue of the vaccination. Vaccination has been with us since the 1800s. Yes, and vaccination is actually the introduction of less harmful or a harmless substance into your body. So in your body, we have what we call the immune system. So what the immune system does is that if something comes into the body and is foreign, they fight against it. So vaccination is, we are going to give you something to sensitize your immune system, like for them to get used to a disease that can be potentially damaging or harmful to you. So we introduce this substance into the body. The immune system will produce antibodies so that fighters, so that in case you get the disease, then you may get a milder form of that disease, or if you are blessed, you may not get the disease at all, because there are already fighters in the body that are going to fight it.
So when most of us have this scar,
the BCG scar
on our shoulder,
left.
They gave us some injection, Ghana map, yes. So that's one to use vaccination.
It's vaccination. So from birth, all of them are vaccines.
Also, vaccination is not new.
It's not new. As I said, the first time vaccination came, I think it was around the 1800 by Edward Jenner. Yes, he introduced, I think, produced the smallpox vaccine. Yes, the concept of vaccination. So vaccination has been with us since. Though for people who are Christians, that at the time the Bible was written, there wasn't anything such as that. So when you go into the Bible, you may not find it. But from the 1800s, that is when vaccination actually came and was accepted. And from the onset that vaccination was introduced, there have always been people who are against it. So all the people talking about vaccination, COVID-19 vaccination, maybe they've forgotten it from birth. So even at, I think, age 5, you receive various forms of vaccines at various stages of your life. Then from age 2, which usually we don't do, you receive the vitamin A vaccine till you are age 5. And there are also other vaccines that we also get. So
because there are some that you give to babies immediately they are born.
They are born so after 6 weeks.
I don't think
10 weeks,
you have to give
14
babies.
Weeks. Yes, so vaccinations are really harmless products.
Okay.
So the COVID-19 vaccine actually the surest preventive measure that can be put in place. You see, all these things that we were mentioning, 1 meter social distances, how long can we even keep up to that? You go to work and
everybody's
for instance, if you're a doctor and you have to examine your patient, you can't stand 1 meter away from the bed.
How will you touch them?
Exactly. So I think all these measures were put in place whilst scientists actually worked on something to bring, I think, an end to all that we were having. So vaccination is the only preventive measure for COVID-19.
But the vaccine came too quickly. We've had HIV/AIDS with us for centuries, since the 90s. And then COVID-19 came, and in less than a year, Monya vaccine. How can we trust something that was so quickly done?
In the fast
too fast. It doesn't make it invalid.
No, it does not. The fact that the vaccine came to, we should even be grateful to God and to scientists that we were able to find a cure, because the lockdown was causing economical stress and a whole lot of mental health. It was killing people and all of that. Yeah. So we should be grateful to God and to scientists that they actually found something that can help prevent the spread and the severest form of the disease and even death. So I think we should rather be more grateful than be bitter or be worried that it came too fast, because that's the only preventive way to
So what
eradicate
are
COVID-19.
the vaccines that are available to us here in Ghana? Because there are plenty. You see, a Bilbe will be one, a Bilbe will be two. Which ones? And are they the same? Are they all effective? The various vaccines we have around?
Yes, all the various vaccines you have around are effective.
Okay.
So currently, the vaccines we have one from BioNTech and Pfizer. So that one you take 2 shots. So you take one, and then after a couple of weeks you take the second one. Then we have the AstraZeneca Covax vaccine. So that's one too. You take 2 shots. You take one, and then after some weeks you take another. Then we have the Johnson & Johnson vaccine. So that one is just 1 shot.
Yeah,
Currently, it's not available in Ghana.
So you see, as she said, Ghana, we get things from outside.
Yes.
So so it's what we are given that we use.
Okay.
So when it initially began, we were given the AstraZeneca vaccine. So that was what was circulated widely. And then after some time, recently the president went to the US, they had some talks, and then the US gave us the Pfizer vaccine. So now we have some of the Pfizer vaccine circulating in the country. I think we have the Johnson & Johnson in Ghana now, presently.
They gave some, and
some people
ran out.
Exactly. So some people too did receive the Johnson & Johnson. So for Ghana especially, we usually get what we have. But aside from these 3, we have the Sputnik V vaccine, which is produced by Russia. That's also another vaccine.
We got a few of those ones some time past.
So as I was saying, so Ghana, the vaccines we have are based on aid we receive from other countries, what we ourselves are going to purchase from other countries and things like that. But what we need to understand is that for Ghana as a country, we get most of our things from WHO's aid that they are doing for African countries to help, and I mean it's all in a bid to increase vaccine sensitization, so in the bid to get as many people vaccinated as possible. So I'm sure we've all heard about this whole rich countries hoarding vaccines. So they are trying to make it, they are trying to create equity and equality in the world. So now they are trying to get vaccines to poorer countries, middle income countries, and then to people who couldn't have afforded the vaccines if they were being sold and things like that. Yes.
So the vaccine, even in Ghana, we don't pay for it. Well, I didn't pay for mine.
No, I didn't pay for mine either.
He did not pay for mine.
So you don't pay for it.
Okay. So after the vaccination, you are given a card. Some people have very weird reactions to the first vaccination that I took. I took it in Tamale about a year ago. I didn't feel anything. All I felt was the jab, and it was on my left shoulder. There was nothing wrong with me. I didn't feel. When some of my friends took it, they had headaches and people fell sick. So I was doing 2 no. I went for the second one. That is a story for. I actually had to be given time off work because I couldn't do anything. It felt like I was sick. And unfortunately for me, I had been infected with the COVID virus before, but it felt like I had gotten another infection. Why is the vaccine doing that? And doesn't that mean that it's bad?
So those are some of the side effects that are associated with taking vaccines. You may have symptoms, as you mentioned. So some people may have fever, headache, sore throat, and without getting the disease. So you may have, and even it's also a sign to show that indeed your body is responding to the vaccine. So it's okay. I also had symptoms when I took my second jab, but then it's just to show that you've taken the vaccine and your body is actually working or creating the fighters, producing the fighters that when, in case you are to get the disease, it will fight against the disease. So it's okay to get those side effects. And it's not just vaccines that we get side effects. For everything we put inside our body, we get side effects. So we shouldn't make so much noise about getting those side effects when we take the vaccines. It's okay. There are even other medications that you take for other diseases and you get other symptoms and side effects. So those are the some side effects of the vaccines. And Yes, it's not everybody too who is also going to have these symptoms, but for those who have it, you should be rest assured that this is to tell you that indeed your body is producing the fighters that you need to fight the COVID-19 in case you are to contract the disease.
Okay, so talking about vaccination, how many people have we been able to vaccinate in Ghana? Because you've made us understand that the more people we vaccinate, the faster we help control the COVID. So are we achieving that in Ghana?
In Ghana, we are about 20 million.
No, 32 million.
About 32 million. As it stands now, as at I think 12 January 2022, about 9.2 million of us had been vaccinated.
32.
Yes.
So not even up to a third of
no, please. And worldwide we are about 8 billion, and about 5 billion have received the vaccine, and among the 5 billion, about 4 billion have received 2 doses of the vaccines that you need to take 2. So the 5 billion, they've received at least 1. Then 4 billion of the 5 billion have received 2, and less than 1 billion have received the 2 and the booster. So that's the current booster. Yes, please. Hey. After the 2 doses, you have to get a booster.
Why? There's a booster. You don't. But I've not heard of it in Ghana.
Oh, there's a booster.
There's a booster in Ghana.
You should get it.
There's a booster in Ghana. Yes. How do you get the booster? Do you have to go and test again or something?
No, after you've received the 2.
After you've received the 2, you go with your card the same way you go with your card. So you go with a national ID card, and then your card that shows you've been vaccinated to any vaccinating center, and then they would give you the booster.
So how long after the 2?
I think it's after about 5 to 8 weeks.
Okay, so
yes, after about
just around the same time you took
yes, please.
The second
yes, please.
Okay. Well, we will be going for a very short break, and then we'll continue this vaccine talk, and we'll see how well the vaccine is actually helping us. Then we'll talk about some other things concerning COVID-19. So, dear viewers, we are going for a very short break, and when we come back, we would continue the conversation concerning COVID-19 and what to do, what not to do. So as we are going on the break, if you have any questions, any suggestions, you can send them to us on WhatsApp on 055-968-006, 055-968-006. Do well to join us when we return from the break. Thank you.
Se wa Ghana nyina ya de Ghana card san register bio. And the Ghana card nkwa na de register.
Wontumi enye phone calls, enye mobile money, enye internet so dwumadie biara ana bibiara wo de some card eye se wan register.
O pesa register mia *404# na de ho nhyehyɛ ne so. Ebehia kan de edidi so every Ghana card so. O Ghana card number wabusua din wodin a edikan wawoda na wa kyerɛ sɛ wo yɛ oba na abema.
Wo benya special code bi e wo phone so a wo de bɛkɔ service provider agent ana customer care biara a eben wo ma wa biometric registration amount ya ka yo na fa register address ka ho ko
mia *404# wo phone so na sha se register wo sim card si a
se wo pe enchiremu foforo aka we hu dia fra wo service provider e wo 100 so ana NCA toll free number 0800110622 register wo sim na to aso di wo nkita ho.
The addition stronko ebrel e wo fie addition eboa ye ma ye dwuma enya nyinaso esanse so adwuma etumpo na ekonkan a osikasem ebe yie
e ma ye ni emfaso bumbum ati na sika enyini bumbum nti se adwuma no edimu saa ansa na wadwen se wodi sika komando
Continental Free Trade Area Agreement ya be ni amapa be na de bresa adwumafo
ye ekuo na nkasa ewo education unit ye do be quantity mu 2 weeks bia
ye de mpanyinfo ba ha na muni abedi nkomo afa ekuo no ho na ehun faso a ewo ema wo odwumayani.
Hope Business Forum, showing this on every Tuesday at 8 p.m. live only on Hope Channel Ghana.
welcome back to the consulting room. Today we are having a discussion on COVID-19 and the vaccination, the vaccines that we have concerning COVID-19. We have a very brief message from the church and from ADRA to all of us. Kindly pay attention to this. All COVID-19 approved vaccines, which include AstraZeneca, Moderna, Pfizer, Johnson & Johnson, and Sputnik V, are safe, effective, and protects against COVID-19 infection. After the COVID-19 vaccination, you may have side effects. These are normal signs that your body is building protection. Getting COVID-19 vaccine is the best thing you can do to protect yourself and your loved ones. Support your community. Help keep businesses, schools, and other places open. The vaccine is free for everyone. You can help stop the pandemic by getting a COVID-19 vaccine. Get vaccinated now. This message is brought to you by ADRA Ghana in partnership with Hope Channel. So ADRA Ghana and Hope Channel are also championing the discussion concerning COVID-19. There are some things that, there are some myths, there are some, I don't know if I should call them false information. Yes, there are some information concerning some of the vaccines that we have now. What are some of the ones you've experienced so far, and what would you say concerning these informations you've gotten from our viewers and your patients?
Okay, so the first one I want to talk about is that some people believe it is actually better and it's a more preventive way to actually get the COVID-19 than to get the vaccine. It is false in the sense that, one, if you get the disease, you may get a very severe form that you may not know the complications that will come from that severe infection. Two, you may even die from contracting the infection. Three, even if you get a very mild or moderate form of the illness, you may put other people at risk. There are some people, because of their age and they have other disease conditions, other chronic conditions that predispose them to get a very severe form of the COVID-19 in case they are to contract them. So if you get it and you don't even have the severe form, you may put other people's life at risk. But then the vaccine is such that you get the vaccine without getting the disease, and you are still going to protect yourself and your environment or your community. Also, I read something from CDC website, and they said people who get the disease are even 2 times more likely to get it than those who get the vaccine. So it means you getting the disease is not it's not a sure banker that you will not get it. It's not a protective way, because it will even depend on the severity of that infection you get, and even your age. Yes, and even your age. So it is more safer to get the vaccine than to wait for you to contract the disease, because people get the disease and they die. Yeah, and
people have very bad side effects from
very bad side effects
a long time.
For a long time. Thank you very much. So it's safer to get the vaccine than to wait and get the disease, waiting for a natural immunity. So that's one myth I've heard about the COVID-19 vaccine.
And do we even know how long the natural immunity lasts?
We don't have so much information about it. You see, I was speaking to a friend who said, oh, if you get the COVID-19, it's okay, you'll be protected. And I was like, we don't know so much about this disease, and we don't even know the long-term complications if you are to contract the disease. So it would be better to protect yourself and prevent contracting it than to wait and get the disease, because you don't even know how yours will turn out, or the symptoms you are going to have, and even if you are going to make it, if in case you are to contract the disease.
There's no predictor that you are a young teenager or young 25-year-old and you got the disease, so you don't get to ICU or even die. There's no predictor of that.
It's not just about you. You may even get it as a 25-year-old very energetic young man or woman, and your mother, who may have maybe a hypertension, diabetes, may be in the house, and you are going to infect. Yes, we have a lot of them with us. So it's not just about you. It's about your kids. It's about your family. So you should protect yourself and your community.
Okay.
Yes, please.
So that's the only part. That's the only myth you.
No, that's not the only myth. There are others.
Please tell us all you know. Okay, so that we can protect ourselves, because I even heard that some people say it's 666. Yeah, the war were odane magnets. Then there were videos circulating that people would put their phones on their
microchip.
Yes, there's a microchip that is tracking everybody, and they want to kill Africans.
Yeah.
They are not true, or they are.
They are not true.
Because if it's true, one can shine.
They are not true.
They are not true.
So you don't become a magnetic force.
No, please.
Not at all.
The vaccine does not contain any ingredients that make you magnetic, or even the arm that you are using to receive the jab become electric. It's not 666. From my study of Bible prophecies, when you read Revelation 14, the 666 is actually a religious power with a political backing, and this COVID-19 vaccine does not impose or prevent me from worshiping on my 7-day Sabbath. On the 7-day Sabbath, neither does it have any restrictions or any enforcing rules or regulations that demands that I do not worship God. And you see, we should not make the 666 also look like something that will take us by surprise. No, it's an informed decision. Besides, we all know about the seal of God. It's a spiritual seal of God. So the same way the 666 will not be a physical mark. We know that people who receive the mark will receive them on their foreheads and on their hands. So my understanding of that, and even the understanding from Bible prophecy, is that you obeying and working for the good of evil. So the 666 will not be a vaccine. No, it's not COVID-19. That will be injected and you are not aware. Then God is not even fair. It's an informed decision for you to follow Christ or reject Christ.
And
so
you will not become magnetic.
No,
forces.
please, you won't become magnetic.
Changing us into these things. That cartoon that Transformers. You are not becoming Transformers.
No, please.
They don't want to kill us.
But you see, we have a lot of foods and items that come from up there. We don't put how many of our products do we have on our markets that even some of the if they actually wanted to kill Africans or make us magnetics, they can use better forms. Like even some of the toothpaste we use, even toothbrushes, they are not produced in Ghana. So
toothpick cry.
Toothpick.
Well, we have
socks.
We have one question from one of our viewers, and the question is: Consulting room, dear doctor, good evening. My question is, what is the difference between malaria extremely hot body temperature and that of COVID-19? Is there a difference between the fever you get when you get COVID-19 and the fever you get when you get malaria?
No, please.
There's no difference.
There's no difference. Fever is fever.
So the thermometer, the gun or the one you put in, it will read the same.
It will read the same. It's not even only malaria.
Will not give me 72.
Oh,
malaria will not give me 20.
Malaria, if you do your RDT, it will be positive. You do your MPs where they take your blood samples, go and look at your blood films. There will be parasites. So that's the only distinguishing factor between COVID-19.
Distinguish between a fever from COVID-19 and a fever from malaria is to get tested.
Yes, you get tested.
You can't
now
assume.
Talking about getting tested, we've heard of some of the tests that are so expensive. I think when the COVID was in its full force, those times you have to pay. Some people were paying like 500 CDs.
Yes,
I don't. How many of us can even afford to test for that one? And then we have now we have the one that is like the malaria test. Which one is the best one? And
okay, so as you initially mentioned, previously we're using a PCR test. So we're using a polymerase chain reaction test.
Please simplify it for us so that we understand.
So basically what that test does is it uses the DNA of the virus. It tests for the DNA of the virus in the sample that is taken. And then, but as we all witness, that test takes a while before you get the results. So as a way of helping us to detect cases earlier so that we can get ahead of the virus, the rapid test was created. The one that's almost like the pregnancy test. So it's just like a small, or malaria test, just like a small casket with lines, and then when it's positive, you see two lines. When it's negative, you see one line, and things like that. So that test was created to help us to quickly diagnose COVID-19. But what we also need to understand is that the rapid test and the PCR test, there are differences. So the PCR test is a better way of getting, it's more accurate compared to the rapid test. It's not to say that the rapid test will give you wrong answers. The rapid test is also accurate to an extent, but then the gold standard is to do the PCR test. The best, exactly. So the best is to do the PCR test. So usually, if you are going to do something and you quickly need the results for something, you can do the rapid test to sort of know where you stand. So if what we've come to realize is that usually when the rapid test gives you a negative, it's most likely you are negative if you do the PCR test. And if the rapid test gives you a positive, it's most likely you are positive when you do the PCR test. But sometimes there are, I mean, every test has yes. So sometimes there are some inaccuracies. So you wouldn't get the right answer. So that's why the PCR test is considered as the best test, because that one is checking for the DNA of the virus. So that is very specific. It's looking for a certain particular coding that the virus has. So that's why the PCR is the good.
I have a question concerning the vaccination. Can children get vaccinated? Are they part of the people that are supposed to get vaccinated? And which of the vaccines can they take and all of that?
I think it depends on the manufacturers. Some are above age 12. I've seen some, but I can't really tell which one is specific. But we have some that are for kids above 12 years, some too are for. But initially when they came, the vaccines were for adults above 18 years.
Well, I'm sure probably because we didn't know so much.
Yes, we didn't know so much about it, but now we have some vaccines that I think kids 12 years and above can receive them. Yes, and I think I've even seen some of them. I will have to cross-check where even kids about 5 years and above can even receive the vaccines.
Oh, then that would be good.
Yes, I will have to check which of them.
You know, there are some people that think children cannot get infected, and there are some people that think it's only those who have the underlying chronic conditions that will get COVID-19, or the elderly people. Or maybe me young, inti me nya COVID, ube huana wenya nothing. Well, unfortunately, COVID is causing a lot of stress, and doctors, musumunya COVID.
Oh, yes.
Mamifa, you mentioned you had one before.
I'm your host for now.
I've even had the infection before.
I've also had.
I think doctors are more. They are at more risk. Health workers. Yes, they are more successful because you are seeing patients every day and they come with fever, and before you test, you don't know.
Consulting room. and say, "Oh, mommy, show mask. I'm going to demonstrate a wrong way that people wear the mask." Now I shouldn't say. Forgive me for. Now I shouldn't say. Now or their best now. Check us through now. Why any say? Well, when the mask came, I was told you put it and you fit it snugly on your face. Then you press the metallic part so that it fits. Some of the men with mustache, they will not even spread out the mask and wear it like this. Then their beard, or that one too is safe. They can wear. It's approved.
No, it's not.
It's not.
It's not.
Are you sure? Because a lot in our churches, that's what they do.
So the mask is supposed to cover your nose and your mouth, not your nose only, not your mouth only. It's supposed to be both. So whenever you wear the mask, you're supposed to spread it out so that it covers.
But emotion.
Emotion. But I mean, we don't really have a choice.
Well, we are waiting for more questions and contributions from our viewers. But then, if there's anything that's probably you wanted to add that we've not spoken about, you can chip that in whilst we share the information about COVID-19.
Back to the age groups, I think the kids 5 years and above, they can get the Pfizer vaccine. Yes, I think Moderna is for those 18 years and above.
Okay.
Yes, yes.
Okay.
So for kids 5 years and above, they can get the Pfizer vaccine. Okay. Yes, and yeah.
So right now we are learning that COVID-19 will not make us magnets.
No.
We are not going to change into transformers.
No.
It is not 666.
No, it's not.
It is safer for everybody to get vaccinated than for us to choose not to be vaccinated.
Yeah.
There's this thing about taking vitamin C. Please, how much vitamin C do we need to take to boost our immune system? Because some people take it like drink. In a day, especially the one that we dissolve now, they will take like 5 or every time they are going to drink water, they are taking vitamin C. What's the right way to do it? And if you do it wrongly too, what could you get as a side effect from overdosing?
So I think now people are really abusing the vitamin C. The vitamin C was introduced because you know vitamin C is a famous immune booster. So if your immune system is strong, then when you get the disease, then you may get a milder form or you may not get it at all. But unfortunately, people think the vitamin C is actually what is the drug, the cure to COVID-19. No, it is not. Vitamin C is just an immune booster. And now I learned people are really abusing it such that they're even getting kidney stones and all of that. So if you buy the one that we put in water that it dissolves, I think the highest dose of vitamin C I've seen being sold is 1 gram.
Yeah, 1 gram.
So if you are buying that one, then just one of that tablet being dissolved in water once a day is enough for you. And even for patients with actually vitamin C deficiency, they don't go beyond 3 grams per day. For adults, they don't go beyond 3 grams a day. But unfortunately, people are taking it morning, afternoon, evening. That is not the cure for COVID-19.
You know, there was a joke on Twitter. Someone says, "Oh, deep bread or sorry, anapa or the vitamin C in it too." So then he uses it to take bread in the afternoon when he's taking lunch. That's the water, the drink he takes with. Okay, so there's another question too. Can pregnant women and people with the underlying medical conditions also take the vaccine?
Okay, so for people with the underlying health conditions, they were initially the people who were supposed to get the vaccines first, and we didn't have enough vaccines in the system.
Okay.
For pregnant women, no, they are not being allowed to take the vaccine because we, I mean, it's not just you, it's you and a baby. So we need, and then as we said, you don't give vaccines to people who are under 5 years old. The baby is under 5 years old. So usually for a pregnant woman
and breastfeeding mothers
would give you the vaccine after you've passed that period. So once you stop breastfeeding and after you've delivered, you can go ahead and take the vaccine. But
could that also be
during that period? No, we don't advise that you take the vaccine.
Could another reason be because we've not studied the effects of the vaccines
in pregnant women, and then the effects it will have on the development of the child in the mother's uterus and all that. So these are all things that are considered. That's why it's advised that pregnant women do not take the vaccine.
Can the vaccine alter our DNA?
The vaccine does not have any
But then you mentioned for the PCR, you are looking for the DNA of the, and we also have DNA.
The vaccine can enter the nucleus of the cell where our DNA is to alter it. It does not have any ingredients or any ability to alter our DNA. So the vaccine does not even get into our DNA. That's where the DNA is actually in the very inside of the cell, the nucleus of the cell. The vaccine does not have anything as such to alter our DNA. See, we are worrying ourselves so much. They want to alter our DNA. If they want to alter our DNA, there are lots of things we are taking from them. They could have used them. But you see, when I was talking about vaccination and vaccine, I mentioned that opposition against vaccines have always been there from the word go. So it's not today that we are hearing people speak against vaccine. And And now, because of social media, there are a lot of anti-vaccine people online. So you go and you are seeing them and you think it's new. People have always been against vaccination, giving a lot of reasons why they should not. But I will advise that everybody take the vaccine.
Can it affect our fertility? Because at the beginning, when this whole vaccination came, some people were saying for women in their reproductive ages, especially those who haven't had any babies yet, you don't have to take it because it can affect your fertility. Is there any evidence to support this claim?
No, there's currently no evidence to support that claim.
So, no. Are you people
I know somebody who actually got the vaccine about a year ago and she's giving birth now. So, oh yes, I know her nurse.
Oh, okay.
So, yeah, there are a number of people who have gotten the vaccine who are currently pregnant and things. Yes.
So they didn't get it. They didn't take the vaccine when they were pregnant. Yes. They took it after, even before they got pregnant. Some have taken it after they've gotten pregnant. Okay, so
I mean after they've delivered. Sorry.
Okay, thank you very much for that information. If there are any concluding advice that you'd want to give us, as our time is almost up, you can let us know so that you be boy home and COVID-19.
Okay, so I would say that the stance of the Seventh-day Adventist Church is that we should actually undergo responsible immunization, which include the COVID-19 vaccine. The church does not discourage anybody from receiving the vaccine. So if you're a Seventh-day Adventist and after everything you still decide not to take the vaccine, it's actually your personal decision not to do so. You see, the church actually promotes health. That's why we have a lot of Adventist hospitals. Decision not to take the vaccine, it's a personal decision, but not the church's stance.
It is because not representative of the
yes,
church.
Of the church's decision. We encourage that our members should go in and get the COVID-19 vaccine.
Okay. Dr. Daddy.
Okay, so I'll just like us to remember, it looks like we are forgetting the basic things. So we should remember, wash your hands, social distance, use the alcohol-based sanitizers, wear your nose mask. Right now, the nose mask is like, it's only a particular group of people who wear the nose mask. You walk in town and nose mask is a suggestion. But, I mean, it would help us, and it also prevents these waves we keep getting, where 1 minute everybody's getting infected and everything dies down, the next minute everybody's getting infected.
Delta and the Omicron,
yeah, all the variants,
Gamma and Beta,
yeah, all the variants. So we should remember the basic things. We should wash our hands, we should use hand sanitizers, we should wear our nose masks, keep a distance. If you're at a place where you cannot keep a distance from people, then that's when it's more important to wear your nose mask. And then you should also I mean, we all know these things. You've been doing them all the time, so we should just continue doing them.
Okay. And then all right. Thank you very much, Dr. Nyako and Dr. Daddy, for joining us today and giving us so much information and advice concerning COVID-19. I'm going to read the message from Adra, Ghana, and Hope Channel to us again, so that it's stays in our mind and it clears some of our doubts concerning the COVID-19. So all COVID-19 approved vaccines, which include the AstraZeneca, Moderna, Pfizer, Johnson & Johnson, and the Sputnik V, are safe, effective, and they protect against COVID-19 infection. After the COVID-19 vaccination, you may have side effects. These are normal signs that your body is building protection. Getting COVID-19 vaccine is the best thing you can do to protect yourself and your loved ones. Support your community. Help businesses, schools, and other places open. The vaccine is free for everyone. You can help stop the pandemic by getting a COVID-19 vaccine. Get vaccinated now. This message is brought to you by Adra Ghana in partnership with Hope Channel. And Consulting Room is also putting our approval on this message. Everybody should get vaccinated. Young, old, those who are not pregnant, those who have underlying health conditions, everybody should get vaccinated, because the more we all get vaccinated, the faster we get over the pandemic and we can return to our normal way of life, and then we would all be happier. So if you still have any concerns concerning the COVID-19 and the vaccines, I would advise you to go to your primary healthcare provider, or go to the hospital, any hospital around you, and speak to a health practitioner, your doctors, your nurses, and they'll be able to provide you with the information that you need. The vaccines are available in most of the major health facilities around the country, so you can just walk in with your national ID card, your Ghana card, that is the one we are diverting to, the Ghana card, your passport, any form of national ID card. You can walk into any health facility and get vaccinated. Protect yourself, protect others, and protect your loved ones, so that we will all be able to stop wearing these masks eventually. It's been a very wonderful time here today. We've spoken about COVID-19. This program repeats on Tuesdays at 1 p.m. and on Saturdays at 3 p.m. So if someone was not able to watch the live one, you can inform the person to watch the repeat, and your questions and your suggestions are always welcome. Do make time to join us next week, Monday at 8 p.m. as we bring you more interesting health topics and conversations. It's been a very wonderful evening, and have a good evening. Thank you.
Your friend, Dr. Williams Kosi Pepra.